Senator Cullinane, you have 4 minutes.
Welcome, Minister, to the House. Minister, the motion I tabled today is very specifically in relation to the closure of the community welfare service in Tramore in County Waterford. But there's been closures elsewhere in Waterford as well. The offices of the Community Welfare Office in Tramore and Cappoquin in County Waterford are to close. But we are also going to see the closure of clinics in Dunmore East, Kilmeaden, Portlaw and Clashmore. So what we're seeing is a withdrawal of services from small towns and rural villages and areas in County Waterford in relation to community welfare services. You will know, Minister, that the individuals who avail of benefits under the community welfare service are people on the lowest incomes and are people on social welfare. And it is regrettable and it is unfortunate and it is wrong, in my view, that what the government is doing is closing down services available to those people in their own areas and forcing them to travel into Waterford City for appointments to see community welfare officers at a time when it's almost impossible for people in Waterford City to get an appointment with a community welfare officer because of the very narrow time slots which are available for people in the first place. So you're going to make what is a difficult situation for people in Waterford City even worse in relation to adding to the list of people who will be looking to seek appointments with the community welfare officers. But you're also closing down a service which is available to people in rural areas. And it isn't just in relation to CWO services. As you know, many small villages and towns are losing post offices, losing Garda stations, there's issues around schools, and now we're taking away one of the vital services for those communities as well by closing the offices or by removing the clinics. And I don't think it's good, Minister. I attended the Constitutional Convention at the weekend, and I was discussing electoral and political reform. And one of the issues that was discussed in the context of reforming the system was this whole notion of localism and clientelism. One of the reasons why we have a very high level of localism and clientelism in this state is because people are not getting a good service from the community welfare officers or from the social welfare system. Not because the CWOs themselves are not doing their jobs, they are, but because resources are so thin that they just are not in a position to provide the public interface with people that they should. People can't get access to their CWOs, they can't get access to social welfare offices. If they try and contact any of the numbers, they can't get through, they leave messages, they get no response, they get deeply frustrated, and they are forced then to come to their politicians to get information from them. We're disempowering citizens. That's what we're doing here. And by closing these clinics and by closing these offices, we are disempowering them even more. And worse than that, it's going to have a very negative impact on those rural villages and small towns who are already suffering. And I think there needs to be a relook at this because, again, this is going to be dressed up as creating efficiencies and centralisation. In reality, this is about more cuts. That's what this is about, saving more money and, as a consequence, withdrawing services for the lowest paid in society and for people on benefits who need to be able to talk directly with community welfare officers or social welfare officers to get information. So that's the context I'm putting this motion down today, Minister, and the questions I'm posing to you. What is the rationale for closing those offices and clinics? Do you agree that it will inconvenience people in those areas? Do you agree that it will have a negative impact on people who are on low incomes and social welfare? Do you agree that those small towns and villages are already suffering from a reduction in services? And do you agree that this is a retrograde step, as I'm sure the people who live in those towns and villages do?
Thank you, Senator. Minister.
Thank you very much indeed. I'm taking this debate on behalf of the Minister for Social Protection, Joan Burton TD. Mr Burton is very conscious of the need to provide efficient and effective customer-facing services at local level for clients of the Department. As part of the relocation of community welfare services to Waterford, the frequency of clinics is being increased from 3 to 4 days per week, and the number of staff available to these clinics will be increased. So it's important to put that on the record, giving clients improved access to services there. The staffing needs for all areas within the Department are continuously reviewed to ensure that the best use is made of all available resources with a view to providing an efficient service to those who rely on the schemes operated by the Department. This includes meeting commitments under the Pathways to Work programme to provide opportunities, support and assistance to approximately 415,000 people on the live register by intensifying the Department's level of engagement with people who are unemployed, and in particular those who are or become long-term unemployed. It was in this context that a decision was made to relocate community welfare services from Tramore to Waterford following the retirement of a staff member. The relocation will take effect from the 17th of June 2013. In the interim, services in Tramore will continue to operate as heretofore. A key factor influencing the decision is the objective of ensuring continuity of service in the event of any future staff absences, which would otherwise negatively impact on the quality of service. An important factor taken into account in the reconfiguration of services was the good public transport service from Tramore to Waterford, with the frequent bus service passing the existing community welfare service offices in Waterford and the main offices of the department. There is also the facility for clients who are unable to travel to Waterford, for example due to illness, to phone the community welfare service in Waterford and discuss their case, and if required, the officer may arrange a visit to the client's home. The reallocation of a service coincides with greater integration between the community welfare service and other locally based staff of the department. This process will be further enhanced by the rollout of a full intro service to Waterford later this year. And I know from the experiences in Sligo, I was at the launch with the Taoiseach, that intro service is a fantastic facility. Absolutely, you should visit one of the offices. They really interface with people unemployed, meeting employers. It's a one-stop shop for people who are looking for work. It should be noted that currently claims for supplementary welfare allowances are generally processed within a number of days where all of the required documentation is in place. Senator,
thank you, Minister. Senator, you have a supplementary question.
Minister, with respect, I know that the speeches are written for you, so I can't blame yourself, but you know, the response, if it wasn't so serious, it would be funny to say that we can justify closing these offices and withdrawing these services on the basis that there is a bus service from Tramore to Waterford. There's a cost involved in getting that bus. There's an inconvenience involved. It doesn't just take a couple of minutes to jump on a bus and get there if you have children and if you have responsibilities and if you're working. So you're making it more difficult for people in Tramore and those other areas in Waterford to get access to those services. And to say that people can phone up their CWOs and get through is again laughable, because it just isn't reality. People ring the phones and all they get is no answer. They leave messages, it goes into a black hole, no response back. That's the reality for the vast majority of people I deal with, and that's the point I'm making. That's why they then end up coming into our clinics, coming in to see us, for us to get the information, because they can't get it themselves. You're disempowering those individuals by closing these services, and to justify it on the basis that there's a bus service, I think is quite laughable, to be honest, but it isn't funny. It's a serious issue, as the Minister would accept. The final point I'll make is this. What I would agree with the Minister is that the idea of a one-stop shop for social welfare and community services is something I agree with, because we need to get away from disempowering citizens to empowering them. And what they have in Britain is one-stop shops where you can go in and discuss the details of any case that you might have and get the information yourself without having to go to somebody else to get it for you. That's where we need to move to. But I'll just repeat what I said earlier, Minister. This is a retrograde step and a step backward for the people who live in those towns and villages.
Thank you, Senator.
Just like to thank the Senator for raising this very important issue, but I have to say now, I'm just speaking from the experiences in my own county of Sligo, where they have an intro office opened, and we have actually a very huge, the demographics of the county are quite huge, and we have the one-stop shop facility where people are unemployed. They have a very focused staff. It's a complete transformation. No way you walk in, you can get a job recruitment, matching up with employers. So I would certainly would be asking the Minister to roll out the intro office as quickly as possible to Waterford, because while it's an enhanced service where I genuinely believe where people find the facilities where, and we have outreach offices all over the region as well, but we have an enhanced centralised service in Sligo, and I can certainly no doubt that it is a pilot scheme, extraordinarily successful. I would certainly convey I think the way to solve this problem would be the rollout of an intro office, which I think you'd be very impressed with, and I think will more than compensate for with the duplication of offices in the rural areas, because it'll mean people that can, with an idea or a concept or want a job opportunity, they can go into the one-stop shop, and it's very much based on state-of-the-art technology, and I think that will be that's eminent in Waterford.
Thank you.